Welcome to our NRP project presentation by Kylie Trelo, Erica Miller, Julia Ramsey, Emily Hogan, Jennifer Bremer, Sean Sklenar, and Jennifer Venyard. Our PICO question is, in adult hospitalized patients, would the use of a non-pharmacological therapy menu for pain versus no menu increase patient satisfaction?
Background. Our topic originated during a discussion of the use of non-pharmacological interventions by our NRP group, and within our own units, we realized that it is inconsistent and underutilized. This led to a list of potential reasons and further questions such as, are nurses and patients aware of the non-pharmacological resources available? Would nurse and patient education on available interventions increase usage? And would a non-pharmacological therapy menu address those issues and thus increase use of these interventions and maybe even possibly decrease the use of pharmacologic interventions such as pain meds? And then what would the actual outcome be? Would patient satisfaction increase with the use of a non-pharmacologic therapy menu? The following 4 slides represent 4 articles with supporting evidence for the use of a non-pharmacological therapy menu.
In this quantitative article comparing various alternative therapies to improve patients' comfort level while being hospitalized, called More Than Pills, Alternative Adjunct Therapies to Improve Comfort in Hospitalized Patients, one can see that there is an 89 to 97% increasing interest and willingness to try alternative therapies without and in conjunction with medications, lessening the emphasis on prescriptions. In addition, it shows an overall comfort level improvement while hospitalized using additional alternative therapies by 88 to 97%.
For Article 2, the level of evidence is A. Article main points. So the title, use of non-pharmacological interventions for comforting patient in palliative care, a scope and review. The study purpose, non-pharmacological interventions implemented and evaluated while providing comfort in palliative care examined on all patients 18 years or older. The methods, all non-pharmacological interventions used in home care, hospice, or palliative care. Factors that influence level of comfort that were analyzed in this review were pain, suffering, fatigue, depression, and anxiety. The interventions included 1 to 14 sessions, lasting anywhere between 5 and 60 minutes. The non-pharmacological interventions used in the studies were aromatherapy, Reiki and therapeutic touch, foot soak, reflexology, massage therapy, music therapy, hypnotherapy, art therapy, and electromyography biofeedback assisted relaxation. The results, music and massage therapy was the most common non-pharmacological interventions used. Conclusion, most common of the non-pharmacological interventions were music therapy and massage therapy. More research is needed due to characteristics of the interventions differing greatly.
The title of this article is The Use of Comfort Kits to Optimize Adult Cancer Pain Management. And the method was they used 500 plus comfort kits, which were provided to 8 trial inpatient and ambulatory units and they were used by trained pain resource nurses. The kits were provided to help nurses identify easy-to-use pharmacological therapies for pain management in cancer patients. The result with the comfort kits was there was an increase in patient satisfaction with pain management, and there was also an increase in patient ambulation. And the conclusion of the overall article was the use of comfort kits is supported, or there was a positive conclusion due to or seen by the increase in patient satisfaction. For future studies or research which may determine which role the nurse and patient autonomy had in the results versus the actual comfort items, and knowing which comfort items were the most effective would be beneficial for future studies.
Article 4, titled Non-Pharmacologic Interventions Improved Comfort and Experience Among Older Adults in the Emergency Department, focused on the use of comfort carts and to see how well they would go over for older adults while they're in the ER. These carts consisted of non-pharmacological agents and geared towards patients 65 or greater, and the survey was completed between the patients and as well as the clinicians to see how well these would go over. The results were really well. There was a big satisfaction between the patients with a 98% rate of satisfaction, a 95.1% satisfaction, and then a 67.5% said somewhat was satisfied. Overall, with the providers, there was a 80% satisfaction or greater, and they said this improved the patient satisfaction, it improved the ability to give compassionate care, it increased patient orientation, and overall, it even improved for patients that maybe didn't want the comfort cart, but just knowing that it was available also increased their experience in the ER and how well things went. In conclusion, the comfort cart was a big success among this population of people, improving their stay while they were in the ER, even if they did use the comfort cart or even if they didn't. Just knowing that it was available was also a big hit for these people.
Recommendations. We recommend providing patients with a menu that includes non-pharmacological pain control options that are available. This menu might include ice packs, heating pads, warm blankets, aromatherapy patches, a simplified list of music channels, ambulation, and massage. This menu has the potential to expand as new information and ideas become available via further research and recommendations from patients, family, and staff. Have additional questions? Please feel free to email any of us. Our emails are listed here in this slide.